many of you would have heard of the term called type 3 DM. Yes, type 3 DM is a term coined by some of the researchers for people who have Alzheimer's disease along with signs of insulin resistance and type 2 diabetes mellitus. Today being the World Alzheimer's Day, I think it is of utmost importance that you all know what is dementia and what is Alzheimer's. So when we say dementia or Maradi Noi in Tamil we call it, so what is dementia? People beyond 65 years of age have a risk of developing this dementia. Dementia and Alzheimer's does not mean the same, but of course dementia is a broader term under which there are different forms of dementia. However, the most commonest form of dementia is Alzheimer's disease. Almost 60% of dementia is Alzheimer's. That's why it is usually interchanged in the when they say Alzheimer's disease or dementia. There are other forms of dementia also, like the vascular dementia, then frontotemporal dementia, Lewy body dementia, and so on, which are not as common as Alzheimer's. Vascular dementia, of course, I think we should all know because it has a higher relationship with type 2 DM. The risk of Alzheimer's is almost 1.6 times higher if the person has type 2 diabetes. So it's at 1.62 times it might look, but if the person has an additional risk of genetic predisposition, that is if their mother or father or anyone in the family has dementia, then the person developing dementia is high. And if that person also has type 2 diabetes, it increases to about 6 to 8 times. So diabetes and genetic predisposition, the risk increases by 6 to 8 times, and almost 2 to 6 times the vascular dementia risk also increases. Vascular dementia, the common way to explain it is that micro strokes which happens in the brain, that's what we call as vascular dementia. So there is a very high risk of dementia and diabetes. I do not want to develop dementia, so what do I do? Is the next big question. The first and the most important step is to keep your blood sugars under good control. So if you keep your blood sugars under control, then the risk can be definitely delayed, because high sugar not only affects your legs, your heart or your eyes, it can also affect your brain. Second, exercise has proven a very utmost important in preventing dementia. So develop a habit of exercising regularly. Number 3, if you are a smoker, definitely quit smoking immediately, because that also had shown to have a higher risk of developing dementia. And 4th, learn a new skill every day. Try to keep your brain positively active by thinking a lot of positive newer skills that can also help prevent dementia in future. Thank you.